Hey guys, Dr. Stephen Greenberg here. Every day we come to you live talking about cosmetic surgery or what we can do to help you look better and therefore possibly feel better. I know it's a difficult time, and I think that we're getting tons and tons of questions about what can we do, when can we do it. So I figured today, Saturday, we'll answer some of your questions for you. We'll answer your questions that I'm getting throughout the day. You can email me at greenbergcosmeticsurgery.com or direct message me or call the office or whatever you'd like to do at greenbergcosmeticsurgery.com can take care of you. So let's go through the questions. Number one is from Deborah, and she's asking, what is the most common type of cosmetic surgery procedure? We talked a little bit about this yesterday. The most common type of cosmetic surgery procedure is breast augmentation. About 350,000 of them done last year in the United States. Liposuction is a close second, by the way, to breast augmentation in terms of numbers. Many of them done. Other very common procedures, obviously, are tummy tuck, facelifts, breast reductions, eyelid lifts, nose jobs, things like that. So that was a very good question from Deborah. Next question is, how long does it take to recover from a breast augmentation versus a breast lift alone? So those are two different procedures. A breast augmentation is placing an implant in, and they look really natural, by the way. It's a half-hour procedure, so it's really quick. With my Greenberg Rapid Recovery Program, patients go back to normal activities in about 24 hours. And a breast lift, we just lift up the breast and remove extra skin and tissue and put the breast back where it used to be. So the difference in recovery is about the same. Breast augmentation and breast lifts, usually patients can be back to normal activities in 24 to 48 hours. And if you had a desk job, it's really fast. I mean, I've gotten a lot of patients back to work the very next day. So those are very simple, easy procedures to recover from, and they're quick. By the way, most of these procedures, this is a question I got also last night, most of these procedures are done in the office ambulatory center where patients go home right away after, which is obviously a super sterile environment. It's not going to a hospital. You should see the offices. They're gorgeous. And they're just cleaned all day long, and they're immaculate. And it's a nice place to have a procedure because you go in and home the same day. And recovery with most of my procedures at Greenberg Cosmetic Surgery for myself and all of the other physicians at Greenberg Cosmetic Surgery are very fast. So recovery is fast. The whole environment is quite simple and very nice. So a patient comes in, they have a team assigned to them of nurses and physician assistants and medical assistants, and the whole thing is made very easy. So patients say, oh, is it a big deal? It's really not a big deal to have one of these procedures. The next question is coming in from Joan, and Joan's asking the difference between a mini facelift and a regular facelift. I do a lot of what I call Greenberg mini facelifts, where I make an incision around the ear, but just go under the skin a little bit and tighten up the muscles and just give it a little bit of pull back to the jowls to get rid of the jowl area here and to the neck area as well. And that's a little mini facelift. When you do a fuller facelift, it's a little bit more extensive, but really not that much. And by the way, everything from me is natural. I'm all about natural. I hate when things are pulled too tight. It's never happening. So the recovery for the mini facelift is a couple of days, and maybe the full facelift is 5 days or so, but very easy recoveries for these procedures. Someone's asking, what is the recovery time for tummy tucks? And that's a good question because it's a little bit different than liposuction. Liposuction is 24 hours. A tummy tuck, I tell patients to take off about a week off from work. Not if you're climbing telephone poles and things like that, but if you have a regular job, I think that it's very simple to take off for a tummy tuck about 5 to 7 days. Sometimes we put little drainage tubes that stay in for a week or so, and sometimes we don't. So that's about a tummy tuck recovery. And by the way, we combine tummy tucks with liposuction all the time. So I like to do a tummy tuck and then contour those sides to bring the waistline in. And some people ask for liposuction of the thighs at the same time. That brings me to the next question, and someone's asking, what is the difference between liposuction and cellulite removal? So cellulite removal, guys, is the dimpling of the skin. It's like that cottage cheesy effect that some people get, women more than men. And liposuction does not take care of the cellulite itself. What has to take care of the cellulite is a laser called cellulase. So the cellulase laser can easily take care of the cellulite. It's a laser that goes under the skin and it breaks up the bands causing that puckering. All right, next question is from a guy, and his name is Rod, and Rod is asking, what are the most common procedures that guys do? Well, it turns out guys are doing tons of cosmetic surgery procedures. The most common procedure would be liposuction, and it's usually the abdomen, love handles, and male chest reduction. And we'll talk about that another time, male chest reduction. But those are the most common things. But tons and tons of guys do noses, tons of guys do eyelid lifts to get rid of the puffiness and the extra skin. So that's pretty much what a lot of guys do. And those are simple, easy procedures too. Guys used to be afraid of doing cosmetic surgery procedures, and it's not like that anymore. So many guys are doing procedures. It's creeping up very, very quickly in terms of the numbers of guys, because they're realizing, listen, they're feeling great as they get older, and they want to look great, and they can get rid of easy things. Next question is about what can we do non-invasively to tone up the abdomen? There are two things that we do non-invasively. Actually, there's more than two, but two main things. One is cool sculpting. Cool sculpting freezes away 33% of the fat from the areas that we freeze. So we put a little applicator on the abdomen, the love handles, the bra roll, the thighs, or whatever it is, and you sit and watch TV for a half hour, and 33% of the fat gets frozen away. Your body excretes it normally. It's actually really pretty cool. And then in concert with cool sculpting, we're often doing what's called M sculpting. M sculpting is a non-invasive way to tone up muscles. This is the coolest thing ever. It's like an electrical stimulation pad or paddle that we put on the abdomen or butt. A half hour, get this one guys, a half hour of doing M sculpting is the equivalent of 20,000 sit-ups. So let me just go through that again. Electrical stimulation on the abdomen. A half hour, you sit and watch TV, it doesn't hurt. And a half hour is the equivalent of 20,000 sit-ups. If you put this on your butt, it's 20,000 squats. We can't do that as people. It's impossible to do 20,000 squats or 20,000 sit-ups. And the reason this works so well is because it stimulates about 95% of the muscle fibers of the abdomen or the butt. And when we do a sit-up, we stimulate only 5% of the muscle fibers about. So this is really making a very nice difference. So a lot of people say, what can I do non-invasively? That's what they do. Also, in combination with my lipo or tummy tuck patients, both for guys and for women, I like to do the M sculpting, because even after you suck out the fat, the M sculpting tones up the muscles. It's actually pretty cool, and I've gotten 6-packs in some people just using the M sculpting. I think that lipo is number one. I think it's better than cool sculpting and better than anything else we could do, and it's quick and it's 40-minute office procedure. That's why so many people do it. And you can get rid of a lot of fat from the areas very easily. So lipo's great. It's minimally invasive. It doesn't hurt. You're in and out of the office very fast. A very light anesthetic with my board-certified anesthesiologist. So that brings me to the next question. This is from Pamela. She's saying, what type of anesthesia do you use for most of these procedures? It's usually some sort of anesthesia that's like a general or a very light general. Sometimes we'll use sedation depending upon what we're doing. My anesthesiologists are there at all times. So they're there for you, and we figure out what the best anesthesia is for the procedure. So sometimes it's general anesthesia, sometimes it's a sedation, sometimes it's local anesthesia. So we kind of individualize this procedure to figure out what works best. Next question is from Jennifer, and Jennifer is asking, how do I know what size breast implants to use? Great question, Jennifer. That answer to that question is simple. We do a whole sizing routine in my office. We do computer imaging if it's appropriate, so we can show you what you look like in a variety of sizes. We also do some other things where we put sizers in your bra and stuff like that. So we'll help you figure out what is the best size for you and what you like. This is a highly individualized procedure. I do a lot of each one of these procedures every week, and over the last 26 years, I have tons and tons of experience. So I've seen everything. I've corrected everything from around the country that patients get sent to me, so we can kind of get it done for you. How long is the recovery after liposuction of the thighs is a question from Christina. And that's a easy question. So liposuction is like taking the air out of a balloon. It deflates you. It makes you smaller, okay? So we're taking care of inches. And the recovery, I usually can get patients back, not the next day, but the following day. So it's a 24-hour recovery. Even that night, I've had patients go out for dinner. So it's not a long recovery. Yeah, you're beaten up, you're bruised looking for about a week or so. That bruising goes away and and it resolves quickly. But for recovery time to go out and go to work and stuff like that, it's very 24 to 48 hours, and you'll feel really good, and your result is down the line. You'll start looking better immediately, because people ask me that every day. How fast do you look better? You look better immediately. You look smaller, but the swelling takes months for it to completely go away. And a lot of people ask me how are they going to get on my schedule and what are we doing about scheduling. We're scheduling people a month down the line. We have tons of people who are trying to get on the schedule. We're opening up nights and opening up weekends, and we're going to get everyone done. So if you call the office or go to greenbergcosmeticsurgery.com, make your virtual consultation. It's like me coming into your bedroom or your living room. Myself and my PA virtually examine you. And by the way, there's a New York Post article coming out this week on me about cosmetic surgery and virtual consults and things like that. So kind of keep your eyes on that online for the New York Post or maybe in the paper, I'm not sure. So the virtual consults are really good because it enables us to examine you and go through what you need, and then we kind of hold on to the date for you for a month down the line. All right, if you have any questions, I'm on Instagram, by the way, Instagram Live, 11:30 in the morning every day, including today, as well as 8:30 at night, and we have different guests and things like that on those shows, 11:30 in the morning and 8:30 at night. It's Dr. Stephen T. Greenberg is that site. If you want to see me for a complimentary virtual consultation or ask me a question, direct message me. Don't forget, go to Instagram, Dr. Stephen T. Greenberg. Someone was saying before we sign off, should be close to ideal weight before lipo? It depends. I tell patients if they're going to lose 100 pounds, yes, but if they're going to lose less than that or just a little weight, it probably doesn't make much of a difference. While we have a month while we're waiting for your surgery, if you can lose a couple of pounds, it's always helpful, or after. It doesn't matter to me all that much unless you're going to lose a ton of weight. Okay, so Instagram, 11:30 in the morning, including today, as well as a half hour from now, as well as 8:30 at night. And direct message me with your questions or tune into Instagram. I'd love to see any of you guys for a virtual consultation. This is Dr. Stephen Greenberg, and I will see you soon. Have a great day, everyone.